Hey everybody, Elizabeth Statlander, marriage and family therapist and mental health counselor. So, you decided to take the plunge and go to therapy for your first time. So now you're scared, you're nervous, you don't know what to expect. And believe me, sometimes I feel the same way when I'm meeting a new client. Of course, as a therapist, I'm very used to meeting new people, so it's probably not as scary for me as it would be for you if you're the client. And you will feel nervous, which is perfectly normal. And that's okay. Just, you're going into a new situation where you're going to be vulnerable and you're going to be sharing some of your problems and personal, very private feelings. And so it would only be natural for you to have, some butterflies and some nervousness, and that's okay and perfectly normal. But what exactly should you expect on your first session? Well, I'm going to tell you. So, first thing that I say you should expect is for the therapist to be on time, and that previous to getting to the first session, whether nowadays it's virtual or it's in person, make sure that you have the address, and you found out whether or not there's parking, or if it's virtual, the exact link. Make sure that you're in a quiet private room or space where no one can bother you or interrupt you, so you have full concentration on the therapist. And you should expect the same thing from the therapist, that when you're talking to them, they're all eyes on you and not on their cell phones or anything else like that. So if you are, going to your first session and you start your first session and you see that your therapist is answering a phone call during your first session, I think that's a very bad sign. When I'm in therapy, my phone is always off and my eyes and ears are focused on you. And that is a fair expectation of a new client. So if that doesn't happen, perhaps you want to consider trying somebody else. But you should have all the information of where, what time. Make sure you know all the payment information, what forms of payment that the therapist takes. And make sure you find out if they take insurance or if they take your insurance or if it's cash pay, credit card, debit card, checks, cash, and what. Because every therapist works differently, and don't make any assumption that you can show up and that they will definitely take a credit card if you haven't already discussed that. So you need to make sure you have all that organized before your first session, which I always go over with all my new clients before we meet so that there's no questions. So the first session, you're going to get something called informed consent. And informed consent, I send mine before the first session so that we don't waste time on that in the first session, but most therapists will give you informed consent when you arrive. And informed consent is our ethical and legal obligation to you, the client, to give you, before we begin, a breakdown in writing of what to expect, what are the risks of therapy, what are my rules as therapist, and we also, of course, will go over confidentiality and when confidentiality can be broken, which there's very few instances that it can be, but there are some. And so we will explain those to you. And we will also make sure that if you have any questions for us, that you have an opportunity to ask those questions. And whenever I offer new clients to ask me a question, a lot of times they're like so nervous and shy that they're like, no, I don't have any questions. And I try to tell people, just relax, breathe. I'm here for you. It's my job to make you feel comfortable. And I want you to ask me any questions that you have before we get started so that you feel at ease and comfortable in my presence. So I would definitely expect those things to happen. And you will also, sign like your basic HIPAA, telling you that if the therapist takes insurance, that they will have you sign your HIPAA papers, and they will explain to you record keeping and how we keep our records. And so on and so forth. So that's basically the beginning of the first session and what it's going to look like, and just some ideas of what you can do to make it less nerve wracking. And then when you go in, it's really, I think, up to the therapist to make you feel comfortable and to open the session. So I know a lot of clients come in to me for the first time and they're like, I was so nervous. I didn't know what to say. I don't know what to ask. And I always tell my clients, that is not your concern. That's my concern. It's my job as the therapist to lead the session, to open the session, to ask questions, to find out, why you're here and what you would like to see change in your life or your relationship with your significant other or your family members or what. We will also do a little bit of an intake to find out if you're taking any medications. And the reason we do that is because there are many medications out there that can have psychological side effects. And so it's critical that your therapist asks and finds out if you're taking any medications, and if so, how much and what and for how long. Because you may be taking a medication that's causing you extreme anxiety or causing you sexual dysfunction or causing you increased appetite or all of these different things that could be really depressing you or making you feel anxious. So it's really important that we know that information. So I would expect to be asked that question for sure. And then remember, it's up to us, the therapist, to take the lead. So you are already coming into therapy very anxious. And the last thing that a good therapist is going to want you to do is to feel even more anxious by their presence, by our presence. So we'll offer you, at least I do, I'll offer you a drink, not alcoholic, but coffee or tea or water, whatever you need to feel comfortable. Take your shoes off, kick your feet up. And I always tell my clients, you can come in your pajamas if you want. This is not a space where we should feel that we can't be ourselves. You don't have to get dressed up to go to therapy. Not for me. I don't get dressed up usually. And just remember that you want to feel relaxed and comfortable going into your first session as much as possible, because you're already going to be nervous and anxious. And then what I will do in my first session is I will speak to, why we are here today and what is going on in your life that brought you here today. And I won't go back to your childhood and all of that, past inventory, because I don't believe that that's helpful on a first session. Most therapists will do that. That doesn't mean they're not a good therapist. That's just sort of the traditional way of doing things. And it's in a lot of our training to do that. I just choose not to, because I don't want to make people wait weeks and weeks and weeks to get relief from the problem for which they are coming to me for. So I like to jump right into it. And if we need to talk about your childhood or things in your history, which we probably will at some point, I leave that for later as it may be necessary, but I try to jump into the immediate problem right from the jump, so that you as the client are not sitting around waiting for a month to actually get to the point. I also do very long sessions. So my first sessions are just about 2 hours long. And that might seem like, oh my gosh, how do you talk for that long? And again, leave that concern to me. You just show up with an open mind and ready to talk and answer questions, and let me do the rest. Because again, it's critical that you feel relaxed, cared about, listened to, and important in your first session. And of course, if you are having individual therapy or couples therapy or family therapy, those first sessions are all going to look different. And I will get into that in one of my next Liz Live dailies, so that you have an idea of what to expect. So that's all I'm going to say for the first session. And you should leave your first session with what I call some really good perspectives. And you should walk out of there with a sense of, okay, there's hope. Hope is the biggest gift that we as therapists can give to other people. And I believe in my heart that all of my clients should walk out of my first session with them feeling hopeful and with some direction and some idea of how we're going to move forward together to make your life better, more exciting, more joyful, all those things. So that is the first session with Liz. Anyway, I can't speak for all the other therapists, but if you're going to somebody else, you're going to have something, some version of what I just described. And you can always ask when you're making the appointment, hey, what should I expect in the first session? And they should tell you and give you a little bit of an explanation of what you're in for. Okay, thank you so much for watching this Liz Live daily on YouTube exclusively. And please subscribe, as you see right here on the screen, to the Elizabeth 126 on YouTube so you can be alerted and watch me and hear what I have to say every day about therapy, mental health, relationships, love, all of those things that we all struggle with. I am here for you. You can also reach me at eliztherapist@gmail.com, and I'm all over social media, Facebook, Actuation Counseling on Facebook, where I do my live podcasts twice a week, sometimes 3 days a week. My YouTube channel, and I'm also on Instagram as Eliz Therapist. #TalkShowTherapy. And I look forward to seeing you tomorrow for the next Liz Live Daily. Have a great day, everybody.